Freezing of gait is an incredibly common symptom, a problem in Parkinson's disease. This is where patients feel as though their feet are stuck to the ground. They want to move, but they can't, often triggered by things like turning or going through a doorway. And it's been a passion of mine in the research space now for over a decade. And I'm very proud of the work that my team has done. I think it's fair to say that we're one of the leading teams in the world for doing this sort of research and the areas that we've covered. So in terms of our understanding of freezing of gait, we've published studies to suggest what it is that might be associated with freezing of gait, what the physical symptoms are, what the risk factors for going on to develop freezing of gait, maybe being able to predict who will go on and get freezing of gait and who won't, as well as whether there are even different types of freezing of gait that relate to different, if you like, patterns of pathology. So whether people are on more cognitive impact, or whether they have more physical symptoms, or whether they have more anxiety, playing into the pattern of freezing of gait that they have. And really getting all of that data together has relied heavily on our research clinic. So again, I'm always immensely grateful that our patients come along and volunteer themselves. In terms of where I wanted to go with the freezing of gait story, it's really beyond admiring it. I wanted to understand it and ideally treat it. And many students in my team will know that you can't join my team unless you want to work on making things better for patients. So in terms of our understanding of freezing of gait, I am proud that we've actually used a number of different techniques. Some of them are a little bit crazier than others. For example, when I came up with the idea of trying to see what was going on inside the brain that, if you like, was the circuitry underlying freezing of gait, I thought perhaps we should test it using virtual reality. So the idea of having a screen in front of you and then just using your feet on some pedals to walk through a virtual environment. And I remember being told by the Michael J. Fox Foundation that it was the craziest idea they'd ever had. Turns out, it wasn't a bad idea, and we actually now have a much more detailed understanding of where the circuitry in the brain is falling over, and that led us to thinking, well, if we can detect it from a brain scan, maybe there are other ways of detecting it to help treat it. One of those techniques is the idea of using electroencephalography, so an EEG. Now, the epilepsy doctors use EEG all the time to see if there are epileptic activity going on in the brain. In our case, what we've been able to do is to actually put electrodes around the head using just a simple headband and detect the change in the signal that happens in the brain before somebody freezes. So this is an opportunity, I should say, for us to perhaps listen into the brain and then alert a patient and their carer about an episode that's about to happen. Many people who get freezing of gait will know that they will fall over if they freeze. So if they could have an early warning system, it might even give them some feedback. It might have a voice, wife's voice saying, lift your knees, you're going to freeze, or perhaps projecting some lines on the floor so that you can walk over them and keep walking. So that was very exciting work, and we're still working on developing it further. It also spawned the idea of going one step further, which is to say, well, if we can listen to the brain on the outside, what about listening to it on the inside? And this, we're very grateful for our collaborators, Neil Mahant, especially at Westmead Hospital and the surgical team there, Jacqueline McMaster, fantastic, and Brian Owler, fantastic people who are game to allow us to go into the operating theatre when people are having surgery, the deep brain stimulation of Parkinson's, and allow us to use the virtual reality environment while the patient was awake, so that we can actually listen into the brain with those electrodes. And then we have some very exciting results that actually back up some of the hypotheses that we've put out before that suggest actually, yes, there is a signal going on in the brain that we might be able to capture. And the reason that's very important is at the moment, freezing of gait is a reason not to have deep brain stimulation. And this might allow us to say, actually, we should be taking people with freezing of gait to have this operation as long as we can work out what to do next. And the what to do next goes in hand in glove with a new upcoming therapy that isn't quite here yet, but this might lend itself to this technology. And that is closed-loop deep brain stimulation. There are videos on my website about closed-loop DBS, or deep brain stimulation. This is the idea of saying, well, my operation that I had the electricity put into my brain is always giving me the same stimulation, whether I'm walking or sleeping. What we're suggesting with our new research is that perhaps if there is this signal that we can hear from these deep electrodes in the brain that warns you that someone's about to have a freezing episode, then perhaps it could tell the system, closing the loop, and say, hey, we're about to have a freeze here. Can you change the settings just for the next 5 seconds or so to change perhaps the walking pattern so that actually the patient won't freeze? So this is very exciting stuff for us, and I think it's important. One of the final areas that we've been involved with freezing is the idea of using non-drug therapies to try and improve freezing. And we have managed to successfully publish one paper already suggesting that cognitive training, so working on the brain's own reserve, if you like, to allow it to think faster and process better, might improve freezing of gait. And this is, exciting because, of course, it may not require any medications or surgery, and of course, any cognitive training is probably going to be good for the patient. So I am pleased about the work we're doing in freezing of gait. I have to say that it is still an ongoing passion and a battle, and we're delighted to have so many patients who want to come and help us to make these advances in the field.